Okay, before I go into the patient's room, I checked her chart. She has exacerbated heart failure, and she has a history of heart failure, so monitoring her fluid and intake and output is very important. So the doctor ordered a Foley catheter, which I think is reasonable, so I'm going to go to the patient's room. Knock, knock. I'll provide privacy. Hello. Do hand hygiene. My name is Elizabeth. I'll be your doctor today, or your nurse today. Your doctor has ordered a catheter for us to put in. Have you had experience with that before? She has a history of heart failure, and she has one in before, so that's good. Can you verify your name and date of birth for me? I'm looking at the MRN number, date of birth, name, everything matches, so I have the right patient. And do you have any allergies? No known drug allergies.
This was the syringe from the
We'll get started. So I'm going to gather my supplies. I'm going
I have
to
my lubricants on. For the mannequin,
put gloves on.
we're using the oil. So I'm gonna put some oil on this to help.
And I'm going to grab a surface cleansing wipe
For a patient, I'll
and
put
come and clean this surface.
and then
Wait for it to dry. And then I would take my gloves off, do hand hygiene, put on new gloves so that we can do peri-care before the procedure.
I'm gonna go all the way in until I have some urine return, and then I'm gonna go 2 or 3 more inches in, and then I'm gonna
Trying to keep her as comfortable as possible, just revealing only what we need.
push it in,
Okay,
inflate my
so can we lift your legs up just enough where you can tolerate it? If it's hard, or if you feel like you don't want to be in this position anymore, I can get an assistant or 2 or 3 just to help me with holding the legs or talking to the patient.
So I would open this, take this out, open,
So I'm gonna put some chucks under.
put it in this container. Put it in the container, and then close it and send it in for lab.
And I have my equipment, and per policy protocol, I would do peri-care.
And put this,
And then now she's ready for the procedure. So I'm gonna take off my dirtied gloves.
put this on the side of the bed,
Do hand hygiene.
and then make sure
Yeah.
to secure.
Now I'm getting ready to set up my sterile field. I'll get a little closer to the patient.
Make sure that it's secure, and then I already used everything here, so I can just take it and dress it as well. I'm gonna assess the skin around my patient, and
I use this as my trash.
again to remove
So
anything
just touching the corners. I'm opening up
and then I'm gonna remove
my sterile pack. My gloves are at the top. I'll put my gloves on right away.
Make sure to put it on the area. So that, and then go back to my patient.
So I'll do a pinch and scoop.
Make sure my patient doesn't
So,
have anything. Do you need anything?
pinching.
To the bathroom or anything? No. Make sure my patient has the personal belongings. Make sure the bed is on. The bed is on the lowest position and locked. Make sure my patient has the cold light within reach.
And then
Make
scoop
sure
it.
that the patient has low. Then it's rolled up. And then I'm gonna open privacy, wash my hands, and then document how my patients are rated.
So I'm gonna scoop my hand into this one.
So you cut yourself with the syringe because you said it was
Yeah, yeah. I was like,
And then
And then, well then there's one more thing. You have to security clear. That was like really tight.
just making sure not to break sterility, so my fingers are sterile. Okay.
doesn't matter.
It didn't look like
Okay. Ready to go. So I'm gonna take my underpad and put it down. And I'm going to, I don't need this lube because we have mineral oil. And providine iodine swap sticks, I do need those. I'll use that after. So I'm gonna take this, put it on my sterile field. I'm gonna open up the package for my catheter and throw that away. And I'm gonna take my lube, put it in the corner of my box, and put the catheter in there.
Oh, this goes on the patient.
Okay, I'm gonna take everything over to my patient. Maintaining sterility. Now I'm gonna be half sterile. I'm gonna touch the patient with my left hand in a minute. First, I will open these up. There are 3 swabs in here for cleaning. So I'll just stick those upright. Throw that away. Alrighty, so grab the first one, clean on one side, toss, clean on the other side, toss it, and then clean right down the center. And toss it, and we can look out for a wink. She did wink at me, so we verify that that's where the placement would be. So I'm gonna grab my catheter, really making sure that it's in that lube. And if you could bear down like you are pretending to go to the bathroom, that will relax your urethra and make it easier to go in. So I see a return. I'm gonna go just about 2 inches more. So that's good. And then I have some sterile water that came with the kit to inflate the balloon. So I'm gonna check. I have a 16 French 5 to 10 milliliter and a 10 milliliter syringe. So I'll attach that and put at least 5 in there. Okay. All right, now that the catheter is in there, don't need to be sterile anymore. I'll take my gloves off.
And we have to.
We did not have an order for a urine sample. And so I would attach this to the patient's leg with slack and hang this off of the side of the bed. All right. And so attaching this, just go just like that, in there, like that. All right. How are you feeling? Were there any pain? Anything? Patient says they're not in any pain, was a little uncomfortable, but that's to be expected. All of my supplies. So do you have to go to the restroom? Patient says no, I just inserted a catheter. So I'm gonna give you all the belongings and your call light, and going to document, do hand hygiene. Yeah.